Welcome to Modern Management of the Older Adult, brought to you by the Institute of Clinical Excellence.
Hello, MMA community. My name is Anushka Ranaraja, and I'm a TA for the Modern Management of the Older Adult Division of the Institute of Clinical Excellence and Doctor of Physical Therapy, here to talk to you about mixed cross-training blocks and when they may or may not be appropriate to use with patients. We're going to focus on EMOM, so every minute on the minute, AMRAPs, so as many rounds or reps as possible, and rounds for time. For an EMOM, so every minute on the minute, you have a set amount of work that you will do within the minute for a given time. A 6-minute EMOM may look something like 10 sit-ups for minutes 0 to 1 and then 3 to 4, 5 push-ups, minutes 1 to 2 and 4 to 5, and 15 squats, minutes 2 to 3 and 5 to 6. The benefits to EMOMs are that you have control of both time and work, as you have the set amount of work to complete every minute. EMOM can really help you increase your work capacity, especially if you tend to take breaks between sets or your patients take breaks between sets. You can also set this up like your patient is going to work for 40 seconds and have 20 seconds of rest within that minute and then cycle through that. Or you can do it where you have a set amount of repetitions they will complete in that 1 minute interval, as I had for our first example. We're going to use those sit-ups, the 10 sit-ups, 5 push-ups, and 15 squats throughout as we look through this. So that's EMOMs. The next one we're going to look at is AMRAPs. You have a set amount of time to complete as many rounds or repetitions as possible. So in a 6-minute AMRAP, you will do as many rounds of 10 sit-ups, 5 push-ups, and 15 squats as you can in that 6-minute time. It can be a great way to finish strength training session and its prolonged duration can promote like optimal performance and technique because you're just worrying about making sure that you're getting as many of these rounds as you can, but doing those repetitions, the set repetitions through that. Using as many reps as possible can also be a great way to find an estimated 1 rep max. If you are looking at doing that for a 1 rep max, you're going to try to keep the amount of weight that they need to be less than what they can do for 10 repetitions, or about what that you can do for about 10 repetitions. But so AMRAP is you have the set amount of time to do the work that you have given, which is like, for example, the 10 sit-ups, 5 push-ups, 15 squats, and as many rounds as you can for that. With rounds for time, it's a set amount of work to complete in the shortest amount of time possible. So you would do, let's say, 3 rounds of the 10 sit-ups, 5 push-ups, and 15 squats in as little time as possible. Rounds for time can result in higher fatigue and an intraset mean propulsive velocity losses compared to other models. So you may not want to give this, especially to someone that's newer, especially because of those higher fatigue levels. But you may give this to someone for homework and be like, all right, this is the amount of work you're going to do. You're just going to go through it as quickly as you can, and then you're done. So that can be really beneficial to some of our patients or clients that don't have a ton of time to do certain exercises, but are willing to do a certain amount of work. Something specifically with rounds for time is you may not want to do this during a session if you have no idea how long that patient's going to take to do that work. Because if you have a limited amount of time for yourself and your patient's going through it pretty slowly, you may end up having to run over time. So it may just be a learning opportunity for you, and it may mean that you have to adjust what the repetitions that you want them to go through are. But just good things to think about when you're going into programming. Something really, really great about using these blocks is that they can be set as benchmarks to track progress over time. I really love doing AMRAP sets, like AMRAP sit to stands or AMRAP step ups. Really allows my patient to get their heart rate going, but it gives us a benchmark again to look at and be like, okay, this is how many you do, and then this is how many you get the next time. So sometimes I'll have like 3 sets of AMRAPs that they're gonna do of step ups, and it's like they're beating their own time each time, and it's so great for them. Like, they're excited that they're working hard. Like, yes, they're getting fatigued, they're getting some rest time between those sets, but they know that it's like, hey, we're just gonna do as many repetitions as you can in this 1 minute or 30 seconds, whatever that interval is that you're setting the time limit for. So I really love that AMRAP set. Again, the EMOMs are really great because you have a set amount of work to do within the minute and then within the given time that you're gonna do that EMOM. So if it's a 6-minute EMOM, they know it's like, all right, I just have to get through 5 push-ups in the first minute, and then I get rest. And then I just have to get through 10 sit-ups the next minute, and then you get rest. And then it's 15 squats, and then you get rest. And then you're gonna do that all over one more time, and then you're done. And it's a really easy way of showing patients what they can do, but allowing them that break time without sometimes allowing yourself a little bit too much break or a little bit too little break. It's just set in there. They can push themselves through that minute how they want. Again, the second one was the AMRAP. So that's a set amount of time to complete as many rounds or repetitions as possible. So you're saying you have 6 minutes of work. You're just going to do as many rounds of this as you can, or as many repetitions of this as you can. So again, those 10 sit-ups, 5 push-ups, 15 squats. You can do whatever exercises you want. I was just picking some ones that are easy and go-tos, but really, really great. And then the third one was rounds for time. So it's a set amount of work in ideally the shortest amount of time possible. But all of these can be, allow your patients to compete against themselves, or you may have like a leaderboard in the clinic for a certain workout that you do, or if you're in a gym, like with CrossFit, we have those benchmark workouts and you can always compare how you do time after time, and that can be really validating to how your progress is going. So great tools to use for your patients or clients or for yourself when you're working out. So that's for that. And then let's talk a little bit about what's going on in the MMOA community. MMOA Live is MMOA Level 1 is currently going on right now, but the next cohort starts October 16th. And then Level 2 starts October 17th. This month, or not really this month we're done because we are off for Labor Day weekend. But we have MMOA Live in Mobile, Alabama and Minnetonka, Minnesota, September 7th and 8th. And then we'll be in Casper, Wyoming or Bend, Oregon, September 14th and 15th. If none of those work for you, none of them are close by, I promise we have an opportunity coming close to you. Just check out mmoa.online. And have a great night. Thank you for joining me.
Thank you for listening to the MMOA podcast. If you found this helpful, please share with someone that could benefit. And if you're looking for more practical content to help you better serve older adults, head over to www.mmoa.online, where you can learn more about our free resources, our community, continuing education courses, and our certification. Once again, that's www.mmoa.online. Thanks for listening.